Hello, thank you for joining me in this educational series called Get Back to Life with Reflex. I'm your host, Dr. Russ Riggs, the Medical Director at the Reflex Knee Clinic in Portland, Oregon. This is an educational series about knee health and how we can help improve our communities one knee at a time. What is cartilage tissue? Cartilage is a specialized tissue covering the ends of bones in a joint. When healthy, cartilage is very resilient, a very tough tissue, and not easily damaged. However, in the process of osteoarthritis, the cartilage starts to destabilize and can be damaged. I want to show you a series of pictures demonstrating how this damage actually looks. So, in this photo, you can see the smooth cartilage covering the end of a femur, and it's absolutely smooth when healthy. After an injury or due to genetic predisposition or through the aging process, there is a change in the biology of the cartilage tissue. Looking here, can you see how there's early fraying, early breakdown starting to appear in the cartilage? This patient has no symptoms. This does not cause any pain, yet the destructive process is already underway. With 5 to 10 more years of this exposure to chronic inflammation, look here in stage 2. You can see how fibers of the cartilage are actually separating from the underlying healthier cartilage tissue. This is still early enough in the stages of osteoarthritis where this patient probably only has pain after certain activities. It's not yet a daily painful condition. Here is a picture of stage 3 osteoarthritis in the knee. Look at all the cracks, crevices, the fissures. Look at the breakdown of the tissue that is occurring and how unstable and unhealthy it appears. Patients with stage 3 osteoarthritis are often experiencing pain on a daily basis, and they are having limitations in their day-to-day activities, such as walking up or down a flight of stairs, or even just going out to the mailbox to pick up their mail. If the inflammation is not controlled in this stage, then we go to stage 4, where you can see the cartilage has completely unraveled, and this joint now needs to be treated with a total knee replacement. If we intervene in the early stages and we shut down the inflammation, we can actually put the brakes on this process, slow it down, and prolong the life of the joint. I'd like to take a few minutes to talk about meniscal tears and meniscal injuries. Each knee has 2 menisci, one on the inside or medial aspect of the knee, and one on the outside or lateral aspect of the knee. The meniscus acts as a shock absorber to help transmit the load with every step. As humans, if we take our body weight and multiply by 4, that's the force that is being transmitted through weight-bearing joints, such as the knee, with every step we take. The average American takes about 3 million steps a year. So doing the math, our knees are subject to incredible amounts of load and stress each year. So maintaining their health is paramount. And a healthy meniscus helps dissipate the load with each step. When there is a tear, the ability of the meniscus is now compromised in its ability to dissipate that load. And the area of injury is now seeing increased contact forces, increased stressors that can start to cause damage to the underlying cartilage. Meniscal tears are extremely common. They are common in young athletes, and we call those acute traumatic meniscal injuries. Because the meniscus does not have blood flow to over 60% of the structure, only the outer portion of the meniscus can heal with surgery. In a meniscal surgery, the tissue is not being repaired. The tear normally is not being sewn or sutured back together. Less than 5% of meniscal tears are actually repaired. Most meniscal surgeries is simply removing or excising the damaged tissue. And research is now showing that by removing that tissue, even though it's damaged, the underlying cartilage and bone is subject to increased force and more susceptible to damage. So when patients come to me with their MRI showing a meniscal tear, they often ask, do I need to have surgery? The answer is, unless you are a young teenager, early 20s individual, the answer is no. Most meniscal tears do not need surgery. The exception to that is if the tear is so large or there's a flap that is getting between the bones that locks the knee up and people can't flex or extend normally anymore. If that's happening several times a week, it is probably prudent to proceed with surgery. Most people with meniscal tears have pain, they have swelling, but those symptoms tend to resolve over about 6 to 8 weeks, and then people can slowly get back to their normal activity levels. If someone goes in for a partial meniscectomy, meaning excision of the damaged tissues, they may feel better and attribute that improvement to the surgery. But I often sit back and look at the timeline because studies have shown that groups who undergo the meniscal surgery, when compared to groups who do not, at a certain time in the future, about 3 months to 6 months, there is no difference in outcomes. And in fact, there has even been a study out of Finland where they did a sham meniscal surgery, meaning they took the patient into the operating room, they put instruments up against their knees so they felt everything as in a normal surgery, but nothing actually went into the joint. There was actually no meniscal surgery, versus the group that had normal meniscal surgery with excision of the tissue. At 6 and 12 months, there was no difference between those who had the surgery and those who had the sham surgery. Other research shows that physical therapy does just as well for a meniscal tear or injury as surgery. So I view surgery as the last resort. If conservative measures aren't working or biomechanical issues are frequent, those are the times that someone might want to consider having the surgery, with the understanding that meniscal surgery will shorten the life of that joint, because the surgeon is removing cushioning tissue from the joint, making another area where that tissue was removed, the cartilage underlying that area, more susceptible to injury. And research has shown that meniscal surgery increases the risk of needing a total knee replacement by at least double. and some studies suggest it's triple the risk of needing a joint replacement if you've had a meniscal surgery, especially when a large amount of meniscal tissue is removed. So what can be done for a meniscal tear? Well, when patients come and see me, first we make sure that we give it time and rest for that area to kind of cool down and get the pain under control. Sometimes an offloading brace will really help by redirecting the force away from the area of injury and allowing the injured area to calm down and cool down. Platelet-rich plasma, when injected into the joint, will bathe the meniscus in platelets and the regenerative factors that they release, and they stimulate meniscal cell proliferation. What does that mean? You're not going to get a new meniscus, but you might get new meniscal cells creating little bridges across the defect that can help stabilize the meniscus and make it less vulnerable to further injury. The other thing that a platelet-rich plasma treatment can do is decrease the pain, decrease the inflammation, add more cushioning and protection to the underlying cartilage, and prolong the life of the joint. So if you've been diagnosed with a meniscal tear, surgery should not be the only consideration, especially in the absence of recurrent biomechanical issues such as locking, where you cannot move the knee. Lots of patients ask me, if I've got bad knees, is exercise and walking going to make it worse? Or if they've had a meniscal injury that they've now recovered from, should they limit their activity? The answer is a resounding no. Exercise, especially walking, is essential for cartilage health. Cartilage is what we call a mechanico-sensitive tissue. That means it needs to be compressed and loaded regularly to maintain full health and function. The research suggests a minimum of 10 minutes of walking per day is needed, and the recommendation is at least 20 minutes of walking a day. If you are walking 2,500 to 3,000 steps a day, you are meeting this threshold. People should not slow down just because they have osteoarthritis, and in fact, the more active they are, the better the joint health. It sometimes requires reducing the levels of inflammation so people can be more active. If the pain is so great that people can't even stand up or begin walking without significant pain, those patients really need aggressive intervention to get the pain and inflammation in the joint under control. With controlling the inflammation, the number of pain receptors will reduce, and over time, the pain gets less and activity levels go up. And that is really the goal, is increased activity and decreased pain, and trying to prolong the life of the joint. I'd like to take a few minutes to talk about osteoarthritis, a very common condition that affects millions of people in the United States and globally. What exactly is osteoarthritis? By definition, arthritis means inflammation of a joint. In the presence of inflammation, tissues are damaged, and over time, the entire joint structure becomes damaged and dysfunctional, leading to loss of use of that joint and disability. The term inflammation is not well understood by most people. What do we mean when we say, I have osteoarthritis in my knee? Well, if we took some of the joint fluid out of the knee and we sent it to a lab and we said, measure these pro-inflammatory proteins, the level of those proteins would be elevated compared to fluid taken from a healthy joint. So these pro-inflammatory proteins are in the joint fluid, and the joint fluid comes into contact with all structures in the joint, especially cartilage tissue. Because cartilage tissue has no blood supply of its own, it must rely on the health or the quality of the joint fluid where it derives all of its nutrition. And as more and more pro-inflammatory proteins are dumped into the joint fluid by the cells surrounding the joint, the fluid becomes less and less healthy and more toxic to the cartilage. The cartilage is a specialized tissue that covers the ends of bones to protect them and help them glide across each other, and helps transmit a load in weight-bearing joints such as the knees or hips. As that specialized tissue is exposed to these pro-inflammatory proteins, it starts to destabilize and break down, and over time slowly erodes and degenerates. This is the process of osteoarthritis, is a chronic inflammatory environment characterized by pro-inflammatory proteins being produced in high quantities, and through the process it accelerates. There's more and more inflammation as the damage occurs. The bad news about osteoarthritis and this condition is that there is no cure. The good news is we do have effective treatments available that can control the inflammation in the joint and improve the health and quality of the joint fluid. Something else happens in the presence of chronic inflammation. Not only is tissue destabilizing and starting to break down, but the number of pain receptors increases in the presence of inflammation. We call this the nociceptor load. A nociceptor is a pain receptor, and as the inflammation continues, the number of nociceptors increases, and so not only does the destruction accelerate, but the pain levels increase tremendously. So in the beginning stages of osteoarthritis, most people have no symptoms. They don't even know that this destructive process is already underway. Then, when there's enough inflammation, people will experience some stiffness when they stand up, or might have short and temporary pain after certain activities, such as going on a hike. As the inflammation persists and the number of nociceptors increases, it changes from intermittent pain to chronic pain. And in the end stages, it can even cause pain at night, preventing people from having a good night's sleep, and becomes very disruptive in day-to-day activities, leading to disability and the inability to do the activities that we enjoy. How can inflammation in the joint be addressed or treated? Well, unfortunately, there's nothing we can take orally, and there are no topical products that adequately shut down the inflammation. There are injection treatments that are very effective in shutting down the inflammation. The most common injection put into joints for osteoarthritis is cortisone, or a corticosteroid like triamcinolone is another commonly used one. The bad news about steroids is they can be damaging to the cartilage, the very tissue we're trying to preserve and protect. So it is my recommendation that people avoid getting cortisone injections if at all possible. It will reduce inflammation, but it will also have damaging effects on the cartilage, especially if given several times a year. There are other treatments that can be injected into the joint that are protective for the cartilage and last much longer. And those are the treatments that I would recommend for anyone seeking treatment for osteoarthritis. Those two treatments are hyaluronic acid or platelet-rich plasma. Both of these treatments, when injected into the joint, will shut down the production of these pro-inflammatory proteins and restore the imbalance of inflammation. We call this homeostasis, or an equilibrium. Without intervention, the levels of inflammation remain high, there is disequilibrium, and that leads to the damage to all tissues, especially the cartilage. So, if you have been diagnosed with osteoarthritis, it means that there is an abundance of pro-inflammatory proteins in the joint fluid of that knee, hip, hand, wherever you have the condition. There are effective treatments. Unfortunately, insurance is only covering hyaluronic acid for a couple of joints, and no insurance companies are yet covering the cost of platelet-rich plasma. So that, unfortunately, today, for most people, is an out-of-pocket expense. To summarize, osteoarthritis is a condition of chronic inflammation that leads to the destabilization of cartilage tissue, causing it to break down over time. Chronic inflammation also results in a greater number of pain receptors, making the condition more and more painful as it progresses. And osteoarthritis also results in a joint fluid that is very toxic and unhealthy and does not offer as much protection to the cartilage in the joint. Anyone who's been diagnosed with osteoarthritis, I recommend see a specialist who is keeping up to date on the new treatments available. Well, that concludes this episode. Thank you so much for joining me, and I hope to see you on a future segment as we strive to improve the health in our communities one knee at a time.
So good to be alive. This feeling's running high.